So in this video, we're going to talk briefly about hip pain. As you know, I take care of patients with bad knees and bad hips, and today we're talking about the hip. Most commonly, when the hip socket, the ball and socket, causes pain, patients will describe pain in the groin crease, so down at the crease where they sit, and down the front of the thigh, down towards the knee, the front of the knee. However, some patients will come to me and say, I've got hip pain, and they'll point to their buttock or perhaps the lower back or the top of the pelvis where your belt sits, and that's actually not where the hip socket is. So first of all, most patients with a bad hip socket have groin pain, pain down the front of the thigh to the knee. And then patients who have, sometimes I call that front pocket pain, like if you were to put your hand into your jeans pocket. Other patients will have what we call back pocket pain. So again, the back pocket of your jeans, that's most commonly associated with lower spine, lumbar spine arthritis, and that will cause pain in the buttock region. So again, first and foremost, we want to talk about, when I'm a hip surgeon, I'm really talking about the hip socket, the ball and socket, and not that broad area that some people say, here's my hip stock, look at my hips. And again, so we want to make sure that's clear. So in general, the number one cause for hip pain, groin pain, is due to cartilage loss to the ball and socket. And over time, what will happen is as the cartilage wears away, just like the tread on a tire, the nerves are exposed. There's nice cartilage up top, and as the cartilage wears away, the nerves are exposed. Once the nerve is exposed, it hurts. Just like a bad tooth hurts, when the enamel wears down, at that point you go to see the dentist. What can you do to help? And so in our case, you would come to see us, we would do an evaluation, we would obtain a history, when does it bother you? We would then do a physical examination. Is there a problem with your range of motion? Are you having trouble putting your sock and shoe on? Are you having trouble getting in and out of the car? You have to lift your leg to get in and out of the car. Frequently a bad hip will cause that. And we will then, at that point, obtain an x-ray, and most of the time a plain x-ray, your history, and a physical exam will make a diagnosis of wear and tear osteoarthritis, cartilage loss to the hip. People also call it bone on bone, right, where all the cartilage wears away. If we find that, in general, there are maybe 4 categories of treatment. Either living with it, maybe you're only having pain once a week, you just wanted to see what the problem was, so you live with it longer. Number 2 are different types of activity modification, getting the weight down. Your hip sees 2.7 times your body weight with every step, so a 10-pound weight loss is a 27-pound weight loss for your hip socket. Maybe changing some of the, I love to run, doc, but it hurts to do that, so I'm doing a bicycle now. Is that okay? Yeah, if it's not causing pain, I think that's reasonable, and you've changed your activity to accommodate for this early to moderate arthritis. As the pain becomes more severe, you might need to use a walker or a cane. In general, injections inside the hip are not performed, as they are not long-lasting. We occasionally do it if we're trying to figure out the diagnosis as a diagnostic test, but not as a treatment. And so then ultimately, most patients are looking at a surgical replacement, or in rare cases a resurfacing, although that is mostly fallen out of favor in the United States again. So again, a hip replacement would be the ultimate answer for end-stage wear and tear arthritis, or if you were maybe when you were born as a kid, you had a socket that wasn't nice and round, but was quite shallow. Those patients have hip dysplasia. We've all heard about that with dogs. Dogs get it. All mammals get it, have a risk of that. And so again, that would be another reason. Sometimes rheumatoid arthritis, sometimes a previous fracture, sometimes kids through the growth plate, they get a fracture, and that creates abnormality and malalignment as a kid, which then leads to arthritis down the road. So those would be reasons that you might need a surgical intervention. So in the next video, I'll show some pictures of the models and what hip replacement looks like.